So let us talk about dysphagia today. Dysphagia is the most common symptom associated with any esophageal disorder. Dysphagia must be differentiated from another term known as odynophagia. Like you can see in the right corner, odynophagia means pain during the process of swallowing. However, dysphagia is simply difficulty in the process of swallowing. Odynophagia is the pain that is caused by esophagitis or carcinoma. But for dysphagia, that is difficulty, there are a number of pathologies. As you can see, I have highlighted in a box that there are 3 esophageal causes, 4 pharyngeal causes, and 5 oral causes. Now, why I have written esophageal, pharyngeal, and oral causes? These are actually 3 phases of the process of swallowing, which becomes the causative points for causing dysphagia. So before understanding dysphagia, we must know about the normal physiology of swallowing. So let us talk about that first. The physiology of swallowing is divided into 3 phases: oral phase, pharyngeal phase, and esophageal phase. Let us first talk about the oral phase. Oral phase of swallowing is when the food enters into the mouth, it is chewed, it is made into a bolus, and by the elevation of the tongue, it enters into the pharynx. The pharyngeal phase is when the food has entered into the pharynx by the elevation of the tongue. It is further classified into 4 or rather 5 steps. First of all, there is closure of the nasopharynx, that is by the soft palate contraction. Then there is closure of the oropharyngeal isthmus that occurs because of contraction of the tongue and the sphincteric action of palatoglossal muscle. Then comes the closure of the larynx. Laryngeal inlet closes, and it is because of contraction of the epiglottic folds followed by false and true vocal cords closure. Then rising of the larynx under the tongue and contraction of the pharyngeal muscles along with the relaxation of the cricopharyngeal sphincter will allow the food to enter into the esophageal phase. It is quite a lot to remember, but you can slow the video down and learn it in a proper way. Now, talking about the esophageal phase, it is when the cricopharyngeal muscle has closed. First it relaxed, it allows the food to enter, then it closes. Now this closing is very important. This prevents the backflow of the food and prevents regurgitation of the food into the respiratory tract. Now, by the process of peristalsis that is conducted by the orbiax plexus in the muscular layer of esophagus, the food will pass down along with the help from the gravity, and eventually lower esophageal sphincter will relax and the food will enter to the stomach. So this is the normal physiology of swallowing. Now, after understanding the process of swallowing, we can better understand the process that caused dysphagia. It is further classified according to the phases, as I already told, into pre-esophageal causes and esophageal causes. A very important point to learn is that any pre-esophageal cause can simply be excluded by physical examination. But for esophageal causes, we have to do a number of investigations that I will talk about later on. Now, talking about different phases, number 1 is the oral phase. Now, if there is any disturbance in mastication, that could be because of any fracture of the mandible or temporomandibular joint or trismus, will become an etiology. Number 2 is disturbance in lubrication. For example, in xerostomia. Xerostomia is an autoimmune disease in which there is absence of or destruction of the glands, the salivary glands as well as the lacrimal glands in the eye. Now, in xerostomia, there is dryness of the eyes, dryness of the oral cavity. Whenever there is absence of lubrication, the food will not be able to pass easily, and that will cause dysphagia. That is difficulty in swallowing. Disturbance in the motility of the tongue. Now, if there is surgical removal, abscess, paralysis, or tumor of the tongue, that will definitely cause difficulty in the passage of food. Now, talking about defects of the palate, if there is cleft palate, there will be nasal regurgitation, there will be cosmetic problems, and eventually oronasal fissura could also be a cause. Now, if there is a lesion in the buccal cavity, for example, Ludwig's angina and stomatitis, they could become an etiology for dysphagia as well. Now, talking about Ludwig's angina. Ludwig's angina is an infection of the submandibular space, usually caused as a result of any dental extraction, and it is caused by a number of bacteria, gram-positive, gram-negative. Now, it will lead to dysphagia and even airway compromise. But how can we prevent Ludwig's angina to actually occur, because it appears to be a lethal condition? So if a dental extraction or any dental procedure is preceded by prophylactic antibiotics, we can save our patients from developing Ludwig's angina and eventually dysphagia. Now, talking about the pharyngeal phase, what are the different factors which become a cause for causing pharyngeal phase dysphagia? Number one, if there is any obstructive lesion of the pharynx, for example, tumor of the tonsils, tongue, pharynx, or obstructive hypertrophic tonsils, they can cause obstruction. Then the inflammatory conditions, for example, if there is inflammation of the pharyngeal structures, for example, tonsil causing tonsillitis, glottitis, edema could be in the case of burn. The abscess similarly will cause narrowing of the lumen of the pharyngeal portion and it will cause dysphagia. Then comes any spasmodic condition, for example, tetanus, rabies. Then is the paralytic conditions, for example, paralysis of soft palate because of stroke or bulbar palsy could also be a etiology. Now, further talking about the second bigger subdivision for dysphagia is the esophageal causes. Now, there were three subdivisions. Now, if there is any pathology of the lumen or wall or outside the wall, they will cause esophageal dysphagia. Talking about the lumen, if there is narrowing, for example, by atresia or a foreign body or stricture in case of Plummer-Vinson syndrome or any other stricture as a result of any endoscopic procedure, it could be an etiology. And then talking about tumors. Now, talking about the wall. As I've already told that inflammation of esophagus is actually causing urinophagia. So esophagitis could lead to both dysphagia as well as urinophagia. But the specific conditions which will only cause dysphagia are, it could be hypomotility, it could be hypermotility. In case of hypomotility, achalasia and scleroderma are the conditions. Now talking about hypermotility. Hypermotility can occur in case of cricopharyngeal spasm, which is a different disorder of esophagus. Now, if there is any pathology outside the wall, it can also cause dysphagia. For example, if there is hiatal hernia and thyroid pathology, then similarly any mediastinal lesion or even the cervical osteophytes. Now, what is cervical osteophyte? Cervical osteophyte develop as a result of degenerative disease of the spine, for example, spondylosis and rheumatoid arthritis. Thank you for listening.